Hi, thank you for joining us in the second part of Tobacco Cessation and Resources presented by Argus Community Catch Program. We left off at the slide, Smoking Cessation Medication, Brief Instructions and Facts. I'm going to be finishing off this fact sheet, questions you may receive from your patients and examples of responses, or questions that patients may have. So what should I do if the patch does not stick? So if the patch doesn't stick, place the patch on a non-hairy skin with the heel of your hand and press for 10 seconds. Do not use moisturizing soap or lotion before applying the patch. You can use medical tape to help the patch stick better. Can I become addicted to the patch? Nicotine from the patch is delivered in much steadier and lower quantities than nicotine from cigarettes, so the chance of becoming addicted is much lower. If I have had major dental work done or wear dentures, should I use the gum or longes? You should use the longes. The gum should generally be avoided if you have had major dental work and or have dentures, braces, or temporary crowns. Can I use the patch and gum for lozenges at the same time? Yes. Using the patch and gum or lozenges together helps many smokers quit. The patch provides a stable dose of nicotine throughout the day, while the gum or lozenges is short-acting and may help with withdrawal symptoms. Can I use the patch or gum or lozenges after a brief relapse? Yes. Continued use of these medications after relapse is safe and can increase your chances of quitting. How do I know if I'm getting too much or too little nicotine? If you're getting too much nicotine, you may have a fast heartbeat, headache, upset stomach, and or feeling dizzy or nausea. If you have these symptoms, stop using the patch right away and call your doctor. If you're getting too little nicotine, you may feel anxious, irritable, have difficulty concentrating, feel strong cravings, experience insomnia, and or have an increased appetite. Do you have any medications that does not have nicotine? Yes. Wellbutrin and Chantix. Those are the two non-nicotine prescription medications that have been shown to be very effective in helping people quit. Wellbutrin or Zyban is more effective when used in combination with nicotine replacement therapy. I need more help to stop. How can I get it? So if you need more help, you can talk to your doctor. You can call 311 in New York City. You can find quit smoking programs. And we're going to be providing more information towards the end of this webinar. Next slide. 4-step treatment approach. So we're going to get into the treatment approach and treatment options that you can utilize in these slides, or you can utilize when consulting with a counselor, a tobacco cessation counselor. So first you want to manage your nicotine. Then you want to manage your behavior, manage your thinking, understanding the urges and cravings, and manage your emotions. So we're going to get into the instructions for relaxed breathing, and we're going to get to each point in the next continuing slides. Next slide. So managing your nicotine addiction. Individuals often suffer from insomnia, irritability, frustration or anger, anxiety, a depressed mood, having concentration problems, restlessness, increased appetite, and weight gain. So managing your nicotine addiction can cause these symptoms, or even though people may even have some of these symptoms prior, if they've started using or started smoking lead cigarettes. So with insomnia, it's usually broken sleep patterns seen in the first day. It peaks 1 to 3 days and it lasts 3 to 4 weeks when you're trying to quit smoking. Irritability, frustration, and anger can last over a month. Most quitters report this. Anxiety often starts before quit attempts. It peaks within a few days and lasts 3 to 4 weeks. Depressed mood can last over a month. Concentration problems, seen the first day of quitting, usually mild, peaks within 1 to 3 days, can last up to 3 to 4 weeks. Restlessness lasts less than a month. Increased appetite and weight gain, appetite change can last at least 10 weeks or more. So these are just some situations that individuals may find themselves in when trying to manage their nicotine addiction. Next slide. So in order to manage nicotine addiction, a lot of tobacco cessation counselors use methods as note-taking, creating a chart, and things of that nature. This is just an example of a chart. It's a 7-day chart where you can write when you have your strongest urge and how you deal with it. So individuals may have the strongest urge in the morning as soon as they wake up, or throughout the day. Something may make them irritable where they need to smoke, where they feel like they need to have a cigarette. And you can document this, and you can document, and it doesn't reflect how you manage. It just reflects it doesn't reflect how you go along the process, but it does reflect how you can manage to deal with the strong urge that you feel throughout the day or in multiple days. So if your strongest urge is in the morning, how do you deal with it? When you deal with it, you can say that today you ended up smoking a cigarette as soon as you woke up, but tomorrow you're gonna try to wait half an hour to 45 minutes before you have your first cigarette after you wake up. Things of that nature. So you can document these actions that you may be taking in regards to your quit attempt and managing your addiction. Next slide. Managing your behavior. Use behavioral coping strategies. Why are smoking triggers important? Ways to prepare for times when strong urges will strike is the key, and reviewing strategies to reduce and quit tobacco. So this is a detailed strategy to reduce and quit tobacco that was taken from a certified tobacco counseling Cessation workbook. And these are some tips. Next slide. So this is the same page of the workbook. It's trying to make it a little bigger so individuals can see. So ways to manage your behavior, controlling your environment. putting away ashtrays and lighters. Limit where you smoke, one room in the house or outside on the porch, not in the car, not at the desk. Break links between smoking and activities. Just sit quietly and smoke. Beware of coffee and alcohol. Sit in non-smoking sections. Don't keep cigarettes handy. Make it an effort to get them. The car, trunk, shed, out of sight and out of reach. Avoid or leave. Avoid tough situations temporarily. Leave tough situations until urge fades. Leave permanently if needed. Substitute other behaviors. Play with something else in your hand. Eat low-calorie snacks. Drink something. Read. Get active. Take a walk or exercise. Hobbies, puzzles, and games. Use delay. Wait it out. Limit yourself to 1 cigarette per hour. When you feel an urge, wait 10 minutes. Slowly increase the delay times. So as we were talking earlier in the last slide, so when you have your strongest urge in the morning and you're trying to work at reducing your smoking, as I suggested, you can wait a half an hour, 45 minutes to have a cigarette instead of the first 10 to 15 minutes. And you can document that. Manage your thinking. Distract yourself. Think about something else. A to-do list. Work, family, a home project. Focus on relaxing images or a place or a phrase that calms you down. Call a friend. Positive thinking. Benefits of not smoking. Thinking positive. Your money is saved. Your health improves. You have good feelings of success. Better physical stamina. You're not always out of breath. Progress you've made so far. Lungs are becoming cleared out. Reducing risk of health problems. Fewer cigarettes a day. Mastering your urges. It's hard to control your urges, specifically when you're going through a tough situation or any type of mental health issue, or if you're through any type of mental health issue, whether someone is depressed, has anxiety, some sort of PTSD or things of that nature. It's always good to seek professional mental help, see a psychiatrist, see a therapist that can help you also manage your emotions and your way of thinking, and this together with tips to help you stop smoking tobacco can work together to better help you manage your emotions. Do things that help you relax. Use relaxation exercises, yoga. Individuals can do acupuncture, can regularly exercise. Again, taking walks, doing hobbies that distract them from what's going on emotionally, that they may feel the urge to grab a cigarette. Next slide. Again, manage your thinking, distraction. Think of something else, positive thinking, understand urges and cravings. A tip of this slide is to get a journal. Complete a tobacco use calendar each day. Write down your triggers. Complete weekly strategies, goals, and progress, and set a goal date. Next slide. So this is a description or an image of a specific tobacco use journal. You can find it online. Use this journal to keep track of your habit and gain valuable insight about yourself. This chart helps identify your triggers, which will help you quit. Each time you use tobacco, fill out the chart below. Repeat each time you use tobacco from the first to the last for a few days. So this gives you about 15 rows. It's labeled as time. So it's 15 rolls for either 15 cigarettes you might smoke in a day, depending on the amount you smoke, the time you smoke, the place you smoke, if you are alone, if you're with someone, what were you doing, how is your mood, and rate your urges. You can rate your urge from 1 to 5. Next slide. Managing your emotions. Why would you need to manage your emotions? What strategies do you use already to deal with stress and learning new ways to relax? So as we spoke before, there's different types of techniques. Everyone is different. Everyone has different techniques or hobbies or ways that they calm themselves in certain situations, or calm themselves when they're feeling anxious or have some type of anxiety and things of that nature. So the tip, urges will pass if you wait them out. Often 3 to 5 minutes. You can write down the strategies to help reduce your urge and create a relaxation log. This is another way individuals can identify how or what they can do to minimize their stress and in turn minimizing the amount of cigarettes they may be using. Next slide. So here is another chart. You can also find this online. Relaxation and mindfulness practice. So you can do it by day. What are you feeling? You can write down what emotions you're feeling at that day. What did you practice? What type of techniques or exercises you've been using? And did you feel better or worse or the same after you practice whatever technique or ways to help you relax and not think in a manner that can reduce your anxiety? Next slide. Preparing for and solving for problems. So this slide will be talking about building confidence around yourself and goals, utilizing these steps. State the problem, outline your goals, list alternatives, view the consequences, and evaluate the response. Next slide. So here is another goals, set of goals that you can use. This is another worksheet from the workbook that I mentioned earlier. Solving your problems. Solve. State the problem. Outline your goals. List alternatives. View the consequences, and evaluate the response. So I want to go out to dinner, but I'm afraid I will smoke if I do. So you go to a nice restaurant, you enjoy the company of others, have a nice meal, and you remain absent from smoking a cigarette. That's one way that you can look at it. So you list alternatives. You stay home, invite people, or prepare a meal. You go to a non-smoking restaurant, or you go only with a non-smoker, or you go by yourself. You review the consequences. Have people over and cook. You can eat a nice meal and enjoy the company of others. Will control the situation. Will be tempted by others, smokers, if they don't invite them. If you don't invite them. However, if I won't be going out, which is important to me, and I will have to cook. So that's an example of an individual who would like to have people over and cook. So another example is going to a non-smoking restaurant. So you go out and eat a nice meal, enjoy the company of non-smoking friends. Smoking friends probably won't go. Exposed to at least number of smokers regardless. If smoking friends go, they will smoke outside after the meal, which will be very tempting. So this is a scenario of consequences that can happen from each different scenario if you were to choose any one of these. So if you go only with non-smokers, you'll have a nice meal, will enjoy the company of others without thinking about their smoking, won't be tempted by smoking friends, will be tempted a little by other smoking in the restaurant. So you weigh your options. You go out alone and you have a nice meal. You won't have to think about friends, smoking habits, may be tempted by other smokings in restaurant, will not have anyone to answer to if you smoke. So these are different scenarios you can write down in regards to whatever situation you're in and analyze it. And think of the alternatives, analyze it, and think of the consequences, and then evaluate the responses. So I want to go out and be with others. So cooking at home or going out alone are not good options. Going to a non-smoking restaurant will help me avoid smokers. If I go with a smoker, I will be tempted. If I go only with a non-smoker, I will be less tempted. So the solution is to go to a non-smoking restaurant with a non-smoking friend. You can analyze each situation for you can use these techniques of solving your problems in any situation that can arise. Next slide. Dealing with lapses and relapses. Describe the event. What effects were you looking for? Did you try to cope? How? Did it help? What effects did the tobacco use actually have? Did using tobacco help the problem and how? Next slide. So improving long-term outcomes, don't fight yourself. How would you feel? Right? You can write down how would you feel if you were to relapse. If you were to quit smoking for a week, but you ended up on the 8th day having a cigarette. Don't beat yourself up. Describe how would you feel. Find what kind of thoughts would you be having, and what might happen to your motivation to stay quit, to basically not smoke anymore. Try not to think negatively and stay focused on success. So if an individual was to quit smoking for a week after having gone through the process maybe 2 months, and on the 8th day they smoke a cigarette, don't beat yourself up. Write down what you were feeling, what happened, why you felt the urge to smoke a cigarette, and if it's one cigarette or a couple, it's okay. You can outline or write down what your goal is for the next day. So today I relapsed, I had 2-3 cigarettes. Tomorrow I'll try to just have 2 or 1, and you can continue on working on your progress. Relapse is going to happen. It happens multiple times, but it's always good to stay focused and stay on success and pat yourself on the back for the week that you didn't smoke. You made it a week, and your next attempt you could probably make a week and a half or 2 weeks. So the tip is your goal is still the same. Your goal is to quit. So it's okay to get back on the horse and ride again. Next slide. Pathways to success. So this is a little outline of individuals who may relapse. So high-risk situations can lead to good coping. Seize the causes, focus on the goal, try again using a better strategy. less chance of a full relapse. You have a high-risk situation and you slip and you use tobacco. You can have poor coping techniques, low confidence, self-blame, I am weak, you feel guilty, loss of control, and then you have a greater chance of full relapse. So positive thinking and positive good coping skills, you have a better chance of you have a less chance of a full relapse, other than individuals who self-blame, who beat themselves up for having a slip. Next slide. This is another sheet from the workbook. Strategies for resolving conflict. Compromise. Adults often think that compromise is the only way to resolve a conflict, ignoring other strategies that may work. Keep in mind that compromise means everyone should get some of his or her needs met, but be willing to bend on other issues. Humor. Humor can be a very effective way to reduce conflict. Be sure to use humor in a respectful manner, not as a way to hurt someone further. Focusing on yourself in good humor is often more effective than focusing on another. Apologizing. People often lose the desire to remain in a conflict once an apology has been delivered. But people often feel as if they are right and do not have anything to apologize about. It is helpful to remember that there is usually a grain of truth in most negative comments. A sincere apology might involve finding and focusing on that essence of truth. Get help. Evolving or getting advice from someone who is not involved can resolve conflict. Just making the effort to find a better way to manage a tough situation is a good start. Before I continue, these are really good strategies for when an individual might be having a high tense anxiety mood, or someone who is very irritable and they're speaking with or having a conflict with their family. It could be a spouse, it could be children, it could be friends, family, things of that nature. So these are good techniques in resolving conflict at the moment. Things that you can learn to reduce a situation from getting graver and from you having a higher anxiety level and an urge to want to just walk out and have a cigarette. Avoid a hot situation. May be a good strategy if the conflict is fairly minor and not worth the effort needed to resolve it. In other words, pick your battles. Postpone. People, even in a conflict, can agree to delay their attempts to resolve it until later, but don't let it go on too long. Most important conflicts will not fix themselves. Take a chance. Often used by children, leaving a situation to chance can be an effective strategy as well. Sometimes you get lucky. Share responsibility. Sharing can be a great approach when everyone involved in the conflict needs to be a part of the solution. Sharing works best when each person knows their role in the situation. And finally, take turns. Taking turns is often overlooked by adults as an option. All must agree to allow each person the option to fully express their opinion. Even if one knows that the other person will say what the other person will say in advance, simply giving one's full attention and really listening can have a positive impact. And who knows, you might hear something you did not know. Next slide. Lifestyle changes. Having social support, changing routine, new activities and hobbies, nutrition, increased physical activity, sleep, follow up with a counselor are all key strategies in lifestyle changes. So it can increase your quit attempt and increase your and decrease your relapse of having to smoke a cigarette if you have these strategies for lifestyle changes in place. Next slide. What can you do? You can set weekly strategies, goals, and progress. You can start to understand your urges and cravings. You can report your progress, keep a journal. Manage. Remember that we all go through different issues that were stated when a person has an addiction. With nicotine, we've listed anxiety, irritability, insomnia, things of that nature. Behavioral change. You have to change your behavior when you feel urges. Thinking positive. Thinking positive is something that can help you reduce your relapse, your chances of relapse. And emotions, controlling emotions in certain environments if there is a conflict. Planning to stay quit. Reward yourself. Create lifestyle changes and follow up and follow through. These are key techniques that you can do to help yourself to quit smoking. Next slide. These are some resources in New York City, in the 5 boroughs, that you can reach out to call if you would like to sit down with a counselor. You can also visit New York State Smokers Quit Line or call 866 New York Quits. And you can apply for a free starter kit of nicotine medication and talk to a quit coach. We'll take a moment so individuals can write down the information if they see anything that interests them. Next slide. How can we help? So we have a behavioral health coordinator. Behavioral health coordinator can help you make appointments with the resources that are listed, can do a brief behavioral health assessment. We can also provide other resources for HIV and Hep C pre and post testing. We can connect you to medical services. We can connect you to substance use services, tobacco cessation services, mental health services, because mental health services are key for individuals who are smokers. Connect clients to local food pantries if they're dealing with any type of stress of not having any food, having food insecurity within the household. We can provide that information, and we can assist in uninsured individuals to get access to medical insurance. So if you currently do not have any medical insurance and you want to start a tobacco cessation counseling program, you can reach out to us and we can help you get started. This is our behavioral health coordinator, Christopher Olin, and this is his contact number. And you can contact him directly. Next slide. And this is August Catch contact information. So we wish you a good luck. We hope you will utilize these tools to start your journey. Please feel free to contact us if you need any help or any further resources. That's a number you can contact us and our social media accounts. Thank you for joining in and watching this webinar. As a continuation of the first webinar, Tobacco Cessation and Resources from Argus Community Catch Program. And I'm Mina. Catch you in the next webinar.